How you doing, Miss Nimbus?
Nimbus.
You doing all right?
Yeah.
You've got some interesting toenails. I got some close-up pictures. We're going to make sure we get those. I'm getting a panoramic view of this nail because it is really very impressive. And then over here on the left.
How long does it take for a nail to grow back?
Well, everybody's a little bit different, but usually about 6 to 8 months. How long you had nails that looked like this?
Probably almost a year, I guess, maybe 8 months, I don't know.
You think they've been around only about a year?
Well, that's what I remember.
Okay, I understand. Wow.
It's thick.
You have onychomycosis, which is nail fungus, but you've also got a serious case of onychogryphosis, or gryphosis, depending on how you want to pronounce it, which is this super thickened, misshapen nail. And we're going to remove these for you. How's that sound?
Yes, that's good.
So the first part of this is numbing up the toenails, or numbing up the toes. And then we let the medicine work, and then we'll take care of removing the nails. Now, Nimbus, are you okay if we video your procedure for all our friends on the internet and YouTube and around the world?
Yes.
Oh, you're awesome. You mind telling us how old you are?
79.
No way.
She doesn't look a bit
I'm probably
79.
going to have to make an appointment and come see you.
Get your claws taken
Because
care
I've
of?
had toes that look like that for a long time.
No, we
Really?
already said we gotta get the chainsaw.
All right. Gummy Jean's going to spray. We're going to spray you with a little cold spray. You feel that?
Yeah.
And then we're going to give you a little shot. One little shot going in. And we're going to do another on the other side, right over here. There we go. A little shot, just a wee shot. We have to do a bigger shot after this, but if we do it in stages, it's not quite so bad. There we go. And then over here. Now we're going to do another shot in each toe that's going to work even deeper. Got it?
Ooh, okay.
Isn't that exciting? But this one we don't have to spray the cold spray because we've already started the numbing process. Here we go. First one in right now. It may just feel like a little pressure, but it shouldn't hurt that much. Wonderful. Let's get the other side over here now. Same thing. You may feel a little pressure, but it shouldn't hurt very much.
Feel stinging.
Do you feel a little sting there?
I did on the right one.
Okay.
Oh, I thought you were done.
The left toe. Well,
Oh, no wonder I didn't feel
right?
it.
That's why you didn't feel a thing on it because we haven't done it yet. All right. You might feel a little pressure there, but hopefully it won't sting very much. Next what we're going to do is we're going to put on some tourniquets here. What do you think? You like that idea?
I don't know.
All right.
Whatever I got. Neat.
That's one tourniquet down. This actually helps the anesthesia work a little bit better.
Take my finger off.
I sure did. Like that little gator. I was telling Nimbus here that I just got back from my vacation trip to New Orleans and that her toenails reminded me of the eye. Nolans, I'm sorry. Reminded me of the eye of this baby gator that we all got to hold. I might have put a picture of that
He was
in.
blind.
They have an opaque
Oh, that.
kind of covering over their eye. Okay, so we're going to give you a few minutes for this medicine to work. Does that sound like a good idea?
Yes.
And we'll be back with you, and we're going to get rid of these bad nails. Gumby Jean, are you ready?
I am. Are you ready?
I don't know. I'm going to give it my best try, though.
Do you usually assist him for this?
Yes, ma'am.
Well, good.
She's a great sister.
She's got experience.
She does. All right, I'm going to gently lift up your toe here and see if I can't slide a nail lifter underneath and see how much of this may still actually be attached. Not a whole lot, I don't think.
Yeah, it looked like one of them was going to eventually come off by itself.
I think given enough time, they probably would, but I think you'd be in a lot of pain when it happened.
Yeah.
Yeah. All right, I'm going to come around here and kind of brace that toe as I push the nail lifter in. There we go, good. I'll tell you, these are kind of challenging. Really, really unusual shape.
The curvature.
Reminds
Yeah.
me of a shell. you
Like a
know,
seashell.
Right, it
seashell.
does.
Yeah.
All right, I think I loosened that one. We're going to come over and loosen the other one. Gummy Jean, can you see all right?
Yes, sir.
All right, good. Are you feeling anything? You might feel a little pressure, or you're not feeling any pain.
Yeah,
though,
a
right?
tiny bit of pressure.
A little pressure. That's okay.
Yeah, that's all right. I'm used to that from at the dentist's office.
Oh, really? Have you had to have a lot of dental work?
Yes.
Bless your heart.
One of my dentists told me when I was young, he said because I was delirious, I had the measles.
Mm-hmm.
He said, I think it affected your teeth because they were coming in and developing at that time.
Really?
So he thought they were more susceptible to decay, maybe, but I still have most of my teeth. I've had a couple of pulled, but
Mm-hmm.
I wanted to keep my teeth.
You're watching.
Ask God, please let me keep my teeth.
Please don't let me have to have dentures, right?
No.
Just put a gentle tug on this, and I can tell you, this whole nail is just popping right off of
Look
here.
at that.
Wow.
That was really an amazing nail. Look at that.
I don't think it's very amazing.
Well, I can tell you, I've seen a lot of these.
I thought, why do I have to live this long and to have this happen after all these years? You know, I've never had it before.
Mm-hmm.
Never had a problem.
And here you are. Well, I think if you make it to 79, you owe yourself at least one set of toenail problems. And I can
No, I
tell
don't
you,
want any.
I can tell you, you've done an excellent job of saving this. You really have. This is very impressive. All right, Gummy Jean, she moved a little bit. I think I pulled her foot over. Can
Yeah,
you
it's
still see
fine.
okay? All right. So we're down to one, and this one's coming loose. I don't want to let that scissor get in the way. Or a hemostat. There we go. Coming right out of there.
That's so
Nimbus,
cool.
you are doing a great job.
Thank you.
She's a tough one.
She's tough. Now, are you feeling any pain at all?
No.
All righty, good.
Is that going to hurt very much later, do you think?
You know what? I don't think so. But let me tell you what. I'm going to give you, I've given you, probably written it for you, a prescription for some pain pills, just in case you need them. Now, you said you were allergic to the tramadol.
No, I'm
to
not.
a codeine, so we're giving you
Codeine.
tramadol.
Yeah.
Can you see that pretty well, Gumby Jean?
Yes, sir.
All right. Well, those are some special toenails. I don't really have a lot more to say about them. But we, just as we got started, we had somebody come in here and draw some blood so that we can check your liver function test and make sure it's going to be okay for you to take the Lamisil. We're going to go ahead and give you the prescription for the Lamisil today. Of course, if we get results back that say that you can't be on the Lamisil anymore, then we'll call you right away and let you know what else to do. But in the meantime, you're going to keep these clean and dry. We're going to put a dressing on these for you. And if you'll keep these dry for 3 days, you'll experience very little discomfort. Now, you might need one of those tramadol tomorrow. And so I suggest you take one if it hurts. And otherwise, you just start taking the Lamisil, which is terbinafine, once a day. And I'll see you back in 60 days. At that time, we'll recheck your liver test to make sure that your body's doing well with the antifungal medication.
Okay.
All right? Do you have any questions for me, Nimbus?
No, I was just wondering if, you know, it was okay because I did have, you know, my blood test done.
Mm-hmm.
And they said the enzymes were a little high.
And that's pretty normal with an American diet. We tend to get a lot of sugar in our diet, and that sugar causes a condition called fatty liver.
Oh.
And fatty liver, is part of that fatty liver condition is elevated enzymes.
And
Would
that's
you like to take a look at these real quick, sir?
But I know what they look like because I had one like that come off.
You did? All
Because
right.
I dropped I had dropped something on my foot,
Mm-hmm.
and I worked with about noontime. And this been a little while back, but
Mm-hmm.
wasn't that long ago. and my foot felt warm, so I took my shoe off, and my sock was half full of blood.
Oh my goodness.
And what it did, it knocked that nail off.
Hold that toe right there. Can you feel your other toe?
Oh yeah, I feel
Okay.
my
Of
second.
course, you probably wouldn't want to hear what I did.
Uh-oh.
Well, I cleaned it up. I put peroxide on it,
Mm-hmm.
and then dried my sock and put it back on and worked the rest of the day.
Did you see? I'd have used some duct tape on there.
Well, I mean, I don't know. I guess I keep peroxide wherever I work.
There you go.
Oh, he's a peroxide. But
They
anything,
said, well, it kills the good germs
Anything
too.
you
Nobody
get hurt.
kills the bad germs.
he tells, it has to be. Did you put some peroxide on it?
I didn't have no more trouble with it. Of course, I did. When I got home, I did put antibiotic cream on it and wrap it.
Nimbus, you're a sport. Thanks so much for letting us record your procedure, and we'll get you fixed up today.